Thank you very much for the kind introduction. Can I just check you're hearing me okay? Can I see a thumbs up or something in the room? Perfect. That's brilliant. You have no idea how much of a relief that is to see those hands go up. Once again, thanks very much for the kind introduction and the invitation to speak at this very important conference. And I was also moved by the opening from from the First Nations, making this connection between, I would say, the natural environment and our heritage and public health. And as was just explained, I'm really genuinely sorry to miss out on the chance of a trip to your beautiful city, but we are trying to, as far as possible, walk the talk in terms of making the connections to speak to as many important audiences as we can reach without increasing our carbon footprint too much. I have a great view of the room. I can see you tucking into your breakfast and coffee. I'm English, and it's tea time here, so I'm going to pour myself a cup of tea from my Canada mug just to make some connection with you, and just to point out this is maple leaf tea kindly brought to me by a kind Canadian colleague. So I do feel like I'm in some way connected to you in the room. So what I'll do in the next half hour or so is briefly to run through what we see as the main connections between climate change and health. And as I put on the subtitle of the presentation, the basic information that we think every health professional, every patient, every health decision maker, every member of the public should know. And much of this will already be clear to you. Climate change, as you've just heard, is basically in everybody's face nowadays. It's hard to deny the reality of what climate change is doing to the natural environment, and to most people, I would say now within the health profession, it's pretty clear that you can't mess around with the global climate system without having an impact on human health. So I won't go into a massive amount of detail on the evidence. What I will do is to recap what we see as the main action agenda on climate change and health. So the field has grown very rapidly within the last 20 years that I've been working on this, but even more quickly and accelerating rate within the last few years. So it's been possible amongst the group of people who have been working on this, which is now an expanding family, to basically come up with some relatively simple recommendations for a global public health agenda on climate change and health. So these messages are basically ones that we're putting out from WHO, but have been developed with our friends and colleagues over the last few years. So there are 7 of them. And just because I don't trust technology, and just in case things will go terribly wrong, I'll count back from 7 to 1, so you'll know when you don't have to listen to me speaking anymore. And what I'll do is, in fact, give the absolute summary in one slide at the beginning. This is the overall consensus, I would say, from the climate change community on what climate change actually means, what we know about climate change, because there really isn't significant disagreement anymore within the scientific community. In certain parts of the world, this is somewhat politically contentious, but even in countries that are close to your own country, there is now a clear majority of the population who recognize that climate change is happening, is mainly human caused, and we need to do something about it. So that summary basically says what we know about the overall status of climate change. And what I hope to do in the next 25 minutes or so is just to run through the kind of agenda that we think will give us hope. And it actually goes a little bit beyond that last line on the slide. It goes beyond the technology. It actually goes to the people and the values that we have and the political will we think we can mobilize to address climate change and to actually make the response to climate change work for health. The first of these 7 recommendations is basically to provide the evidence. It is to tell the truth, basically, about what's happening with the global climate. And we know that global temperature is increasing, and we know that this is mainly due to carbon emissions and the accumulation of carbon dioxide and other greenhouse gases in the atmosphere. So we've known this basic science for actually more than 200 years. It's been known to physicists what they would expect to happen if they double carbon dioxide in the atmosphere. We're well on the way to doubling carbon dioxide in the atmosphere, and sure enough, we're seeing it in the temperature signal. So we've already experienced about 1 degree centigrade increase in temperature since the pre-industrial era. And we see this around the world. It does vary a little bit where you are in the world, what is happening to the local climate. So this is where I'm sitting at the moment. Each of these stripes is basically, it's a color chart which is deviations from average temperature, with blue being a colder than average year for this time period over the last just over 100 years, red being a hotter than average year, with the intensity of the color obviously proportional to the departure from the mean. And basically it's absolutely clear that where I'm sitting, we've seen a clear trend, with most of the warmer years being in the last few years. I live just over the border in France, same pattern. Where you're sitting in Canada, same pattern again. There are variations, and in fact, one of the things that came to my mind as we heard the opening address to the conference is that the rate of warming is actually greater at the higher latitudes in the north than it is elsewhere in the world. So there are certain populations that are even more affected than others. But it is also very clear that at the global level, there is no dispute that the Earth is heating up in a significant way. So the next question is then, what does that actually mean for health? And from the WHO side and with our partners, we think that there are basically two asks of the public health community, two things that we have to do to respond to the threat of climate change. The first is that we have to get behind the global push to reduce carbon emissions. Given the close connections between the state of the natural environment and everything on which good health depends, from our food supplies to clean water to security from extreme weather events, we can't carry on polluting the global atmosphere and not expecting it to come back and hit us in terms of health and many other damages to the human and the natural environment. So we have to get behind this push. So we have to meet the Paris Agreement targets to try and limit global warming to at most 2 degrees centigrade, ideally less than 1.5 degrees centigrade. And we've already used up 1 degree centigrade. So this graph shows basically the depths of the emissions cuts we're going to have to make if we're going to meet those Paris targets. The red line shows the path that we're on at the moment. So we have to play our part in this global drive to reduce carbon emissions. And as I'll come to a little bit later in the presentation, we think that the health community actually has some of the best arguments, some of the strongest voices that can help make that political case for driving down carbon emissions, and in fact doing it in such a way that we get a massive boost for health as well. So that's the first item on the agenda. The second is that given that we are now committed to a certain level of climate change over the next few decades, we have to protect people's health from the risks that we know are in the pipeline. So some of these risks we know are already increasing, so we can measure the extent to which the numbers of people exposed to harmful heat waves are going up around the world. But it's also important to remember that climate change is a different kind of health challenge. It's not just one disease with one vaccine or one intervention. It's hitting on a whole range of different determinants of health and therefore a range of different diseases. And this is everything from more extreme floods, droughts and storms. It's increasing the climatic suitability for transmission of infectious diseases such as malaria and dengue, or waterborne diseases, diarrhea, cholera and others. And in the most extreme cases, for the most vulnerable populations, stresses like sea level rise are going to basically make certain parts of the world uninhabitable. We are going to, unless we really drive down carbon emissions fast, we're going to be driving people out of their homes and submerging small island developing states. So we have this massive agenda to try and deal with this diffuse range of health risks that are coming down the pipeline from climate change, and we have to cover all of them. And we're also seeing that the range of risks that we thought we had to deal with, that I showed on that last slide, they're in fact more risks than we thought. Up until about 6 months ago, 8 months ago, hardly anybody had ever talked to us about the mental health impacts of climate change. And yet that, to be honest, that is almost all I've heard within the last 6 to 8 months. And we're seeing it in direct conversations with people. We're seeing it from when we look at the reports that countries are now producing on their health risks from climate change. Things like mental health are adding themselves to the list, along with infectious disease and so on. So we really do have a very big, wide fight on our hands to address all of these risks. So the final point on that first item on tell the truth, present the evidence is that we are now, I think, getting quite good on presenting not only the global picture of the health impacts of climate change, but going country by country, showing what the climate projections are, showing what the underlying vulnerabilities are, and therefore showing what countries need to do to protect their health from climate risks. So we produce climate and health country profiles. We've done about 50 now. We'll scale that up to about 100. And we tell all of that story, and we also show that the opportunities that we have to address, to protect and promote health as we address climate change. So that's the counting back. That's that's number 7 on my list. So counting back up now to number 6. The next thing to recognise is that the health impacts and the impacts of climate change in general are completely unfairly distributed. It's a general rule across this issue that those people who have contributed least to the greenhouse gas emissions which are driving climate change are those which are most exposed and most vulnerable to the consequences. So this map that I'm showing is showing that at global level. This is based on analysis that we did almost 20 years ago now for WHO, with countries on the bottom part of the graph scaled, inflated by our estimate of the health impacts of climate change. And the basic story here is that those countries, those populations that already suffer from diseases such as diarrhea, malnutrition and malaria, which are highly sensitive to climate risks, have very poor public health systems and are therefore most vulnerable to the health impacts of a warming climate. And yet those are the ones which have the lowest per capita greenhouse gas emissions. And this is not to actually point the blame at the north to countries like the one I'm from or the one that you're from, but it's to recognise that we should have global solidarity, that we do, I think, have a moral duty to protect those who are most vulnerable to risks that these people did not cause. So the way that translates in terms of recommendation is that the world has now signed up to the Paris Climate Agreement. We think it's a fantastic thing that on that front page of the Paris Agreement, it cites the right to health. It says that every action that countries and the populations take in order to address the climate change should be taken with respect to the right to health and other human rights. In fact, the right to health is the first one in that list. So we make the case that because of this basically disparity between those who are most vulnerable and those who have most control, if you like, over the emissions on climate change, we have to take that right to health seriously, and we have to implement the Paris Agreement like we mean it when we talk about protecting the most vulnerable populations in the world, because otherwise we're just going to carry on widening health inequities. So that the counting back, the 6th recommendation is to actually take that commitment to the right to health, which is in the Paris Agreement, and to translate it into everything that we try and do under the Paris Agreement, including the political commitments, including climate financing and so on. We have to take that seriously. So counting it back again, so number 5 is to recognise that most of the real debate now around climate change and why we're slow to act on climate change is effectively a debate about money and who will lose by taking the actions that we need to take on climate change. The general constraint on taking the actions we need to take are that it costs money up front to transform our economies to be green, to shift to greener energy, to greener transport systems, and so on. So we have to recognise that reality. But on the other side of that, we from the health side think that it's important to recognise that the health gains that we would get from acting on climate change are so large that they would actually outweigh the economic value. So basically, the way this works is that if the countries, particularly the countries which, the rapidly emerging economies, which will will be the main determinants of climate change in the next few decades. The level of air pollution in those countries is so high that the actions that we need to take to cut greenhouse gas emissions, to clean up energy systems, if you put a value on human life, we're not very keen on that, but we're keener on that than ignoring human lives completely. If you put a value on human life, then the health gains that would come from cleaning up our energy systems, getting rid of air pollution, would actually be, at the global level, twice as large as the costs of fixing climate change. And so we think that health has a strong economic argument to contribute to this inertia on fast action on climate change. And just to add a little bit more detail to that, if people really started to value health in their economic policies to address climate change, then such actions as putting a price on carbon, such as I understand that you already have in parts of Colombia, parts of Canada, including I think British Columbia, then the action of putting a price on carbon, because it drives to clean up economies, actually cuts air pollution deaths by a significant amount. It cuts carbon dioxide emissions by a significant amount and generates tax revenues that you can put into other socially beneficial things. So we think that the fact that the economic argument over climate change has tended to ignore health and healthcare benefits for a long time is actually missing half the story on what we need to do on climate change. So this is one of the main things that we think we need to bring forward from the health side. If you're serious about economics, then you have to include the health gains that we will get from cleaning up our energy systems. Counting back now down to number 4, it's also to recognise that not everything needs to be done or can be done at the national level. We recognise that we're in the UN system. We respond to national governments. They're our bosses. But we also recognise that much of what needs to be done actually happens at the city level. And so when I was looking into doing this presentation, I Googled what is going on in Vancouver in terms of promoting sustainability. And as I would expect, and as we now see in most high-income cities are becoming very serious now about cleaning up the environment and doing it in such a way that promotes health and well-being. So we absolutely need to get behind that subnational movement as well, because so much can be done at the city level. And just an illustration of that, we have a campaign called the Breathe Life campaign, which basically makes the link between air quality and climate change and targets directly individual cities. So we move away from just telling a global story or even a national story. And so we can tell you for pretty much any city in the world what your level of air pollution is, and we can illustrate how actions on climate change and air pollution will benefit your population. So you probably already know this, but Vancouver has one of the best levels of air quality in the world. So in some ways, I'm preaching to the converted in terms of cleaning up the environment in a way that also promotes health. Canada is one of the few countries that is consistently meets WHO air quality standards. You are actually in Vancouver, on average, 30% below the level that we consider starts to become hazardous. But I would say even so, even though Canada is really good on this issue, on average, you still lose 6,500 lives each year from air pollution across the country. That's a significant burden. So that even in one of the cleanest countries in the world, there are still gains to be made in terms of cleaning up energy systems. I would also make the case that the health benefits of these kinds of decisions go beyond just air quality. If you can put into place a sustainable transport system that allows people to walk and cycle to work rather than getting in their cars to drive everywhere, you start to put some positive pressure on what is determining rates of physical activity and obesity and so on. If you are able to promote sustainable diets, which have a higher level of vegetable intake and a lower level of meat consumption, that's good for cutting carbon emissions and tends to be good for health as well. So even in countries where the air pollution problem is not such a severe issue, there are many things that you can do which will promote health, which are also good for the global climate. And just to drum home why we think this is so important at the global level, in contrast to cities like Vancouver, many of the fastest growing economic regions of the world have levels of air pollution which are off the scale compared to what we consider safe. So on an average day in Delhi, the levels of outdoor air pollution are 14 times what we consider to be the safe level. And in cities across much of South Asia, across China, even to a certain extent across parts of Europe, we have air quality which kills globally about 7 million people a year from indoor and outdoor air pollution. So this is why we think it's so important to make the case that many of the things we need to do to address climate change will bring immediate health benefits, which will help make the political case as well for the actions that we're trying to promote. So that's just to emphasize, again, that we also think there's a real advantage in talking beyond the national level, going to the local and the city level. Counting back further, number 3, and I mentioned this on one of my early slides, given the range of health risks that we now have coming from climate change, we absolutely have to strengthen the resilience of our health system to the range of climate risks. And the challenge that we have is the diversity of these risks. The introduction to this presentation talked about the fires in Australia. The only thing that stopped the fires in Australia was effectively floods in Australia. The country that I come from, the UK, is large parts of that are submerged at the moment, and you don't have to look back very far to see these all of these stories of more extreme weather events, more extreme floods and droughts and so on. So this was a slide pulled from a presentation just a couple of months ago, massive floods in Iran, which were a really big problem that WHO had to deal with. And we're having to deal with these on a more and more frequent basis. So the kinds of things that we have to do is to get better at dealing with floods and droughts, to strengthen the physical infrastructure of our health systems as well. So to tell a positive side of the story, we're putting a lot of effort now into healthcare facilities for example, in cyclone-prone areas that are both more resilient so they don't get knocked over when the next hurricane or cyclone hits, but they also use solar panels, they also use water recycling, and they have a lower greenhouse gas footprint at the same time as being more sustainable. Patients also like them. So there are many things that we can do to strengthen resilience at the same time as providing a better service and cutting the carbon emissions of the health system as well. It also means getting better at detecting and responding to infectious disease outbreaks. So in many parts of the world, many of the most severe infectious disease threats, things like malaria or dengue, are highly sensitive to climate conditions. Because we know they're sensitive to weather and climate, we could actually provide early warnings for many of these disease outbreaks by looking at weather and climate information. So that would help to strengthen the resilience of the system. And we also have to be basically prepared to respond in a stronger and faster way to the impacts that we know are coming down the line. I won't dwell on this next slide, but it's just to make clear that because the range of threats from climate change is so diverse, we believe we have to take a whole system approach. So it's not enough to say, well, we'll just deal with malaria through an early warning system, or we'll just deal with the health infrastructure. We think you have to look at the building blocks of health systems, everything from your leadership and governance, to the training of your health workforce, to your information system, to the technologies that you use in healthcare facilities. And in all of those, you can build in climate resilience and also lower environmental footprint. So we have guidance basically on how you can do that, and that's being used in countries from the lowest income countries to Canada, to countries like Canada and the UK. But it helps to make sense to a health decision maker, a stressed health planner who has a million different things to do with, to say, we're not telling you to give up the day job. We're saying, look at the system you already have and see how you can build climate resilience into it, because it's going to save lives now, it's going to improve health now, and it's also going to reduce the risks of climate change in the future. And again, on a positive note, we're starting to get pretty good at this, and we're moving pretty fast. So it's quite shocking to me now that I have been working on this issue for about 20 years. I do say that when I started talking about this issue 20 years ago, the number of people talking about climate change and health, we could have met in a phone booth. There were that few people working on this issue. We now have a very big community. It's a real pleasure to be talking to the wider health community, such as is represented in your room about this issue. And we're also starting to really implement this on the ground. So each of these circles on this map is a project on health adaptation to climate change, which is at least $500,000 per country. If I showed you this map 6 or 7 years ago, there would have been nothing on it. So we're starting to really see action around the world on what it means to strengthen health resilience to climate change. There are still constraints on this. The same story can be told in any country around the world or at the international level. We're not very good at joining up climate action with health action. So here's my illustration of that. If you look at the commitments that countries are making to the international climate negotiations, and the ones they made in Paris, the ones they will renew at the end of this year in Glasgow, most of them are now starting to say that we're concerned about health impacts of climate change. It's not just the environment, it's health. And then when you look at where climate finance goes, hardly any of that goes to health, basically because the health people are not well connected to the climate people. And I know Canada is much better at this, much better at most things than many countries. I'm sure you're more joined up than most. But I would expect that even in Canada, there is some level of disconnect in general between the core health community and the climate and environment community. The more that we can link these two, the better. So counting down now to the second to last of the recommendations that we're making, and it is going to focus again on air pollution, but there's this wider message on basically the health co-benefits of climate change mitigation, or to put it another way, the things that you can do which are good for health at the same time as cutting carbon emissions. So to illustrate this, this is a slide I've borrowed from a friend and colleague who's been working on this, I think, for even longer than I have. He used to lead the US Centers for Disease Control environmental health program. He's a big proponent of champion of action on climate change and health. And he makes the case that this is how people used to get to school in the United States. So this is a photograph from the 1950s. He thinks this is the last time this ever happened in the United States, that people got to school in this way. But he points out that when people used to do this, that had benefits for physical activity, for the children, but also for the parents. It had lower contributions to air pollution. It reduced carbon emissions. It increased social capital, connectivity between people, good for mental health, lower rates of depression, lower rates of injuries, lower rates of osteoporosis in people as they age, and so on and so on. And there is good epidemiological evidence for each of these, but it's just to make the case that if we can look again at the way that we provide these basic services in the light of what we need to do to cut carbon emissions, we will see that there are many ways to do this that will bring us very big health benefits. Another way of presenting this is to think, okay, how do climate change people view the climate change problem? The way they view it is to say, well, carbon emissions come from different places. They come from buildings, they come from industry, agriculture, and so on. And each of these contributes to the overall burden, if you like, of greenhouse gas emissions. So the circles each of the circles on this graph is scaled to the contribution of each of those sectors to overall greenhouse gas emissions. So that's how they see the problem. They say, okay, we have to control or reduce emissions from each of these sectors. But from a health point of view, we can also see that in a different way. If you look at the transport system, which is the fastest growing contributor to greenhouse gas emissions, well, that is also a major determinant of deaths in road traffic injuries, or contributor to physical inactivity and the number of deaths that we get from that. If you look at the way we provide electricity and heat and so on, that's a major contributor to outdoor air pollution. If you look at what goes on in terms of internal energy systems, particularly in the poorest parts of the world, that's a big contributor to indoor air pollution as well as outdoor air pollution, and so on and so forth. So we make the case that as each of these sectors thinks what it needs to do to cut carbon emissions, they should think about the health consequences as well, because in most cases, health is going to be a really good argument for why you should be going greener. Because if we don't, we're not only going to see the emissions grow, these are the projections from the IPCC, but we're also going to see those health issues grow as well. And that's what happens to global carbon emissions if we don't control them. So I'll just take a few minutes just to go through the air pollution story. Again, it's not the only one, perhaps not even the most important one in Canada, but it is one that at a global scale is massively important and where the connections, I think, are quite easy to explain. So this is an image of one of the most polluted cities on Earth. This is in Nigeria. And I think this is basically the same kind of situation you would have seen in London in the 1950s or Philadelphia around the same time. And you can imagine, and those of you in the room who are clinicians will know what that is doing to the lungs, the brains and the hearts of the children who are exposed to that. As I said earlier on in the presentation, most people around the world breathe air that we consider unsafe to breathe. They are above the WHO air quality standards. And this is an image basically of a healthy lung on one side, and the lung on the right-hand side is not, as you might expect, the lung of a smoker. That's the lung of somebody who has never smoked in their lives, but who lives in a highly polluted city. And so the overall burden of air pollution around the world is as big as any other health risk factor that we have. It's just about the same as tobacco, as smoking. It's around about the same as all of the risks we get from poor diet, undernutrition, and so on. And 2/3 of the exposure to outdoor air pollution is from fossil fuel combustion. So the drivers of the climate crisis are very much the drivers of the air pollution crisis and the health burdens that go with that. We also know that the risks increase rapidly with exposure. So this is recent evidence basically on the hazard ratio of lower respiratory infection, stroke, COPD, lung cancer, ischemic heart disease, and so on, as you increase levels of particulate matter of 2.5 microns or smaller, a standard measure of air pollution. And that's where the WHO air quality guideline value is. And as I say, 90% of the global population is on the right-hand side of that graph. So this is why we keep drumming home that air pollution is the most obvious reason, most obvious argument for why we can solve the climate crisis in a way that also promotes global health. Because around the world, we are seeing some progress in air pollution in some parts of the world, and some parts of the world are already pretty good to start with. But in others, those levels are continuing to increase. I would point out on this slide two parts of the world. One is India, and South Asia, where the problem is terrible and, if anything, getting worse. The other is China. And if I was making this presentation 10 years ago, I would have been presenting on China as the test case for terrible air quality. You will see that China is actually now starting to get on top of its air quality problem. It's also levelling off its global carbon emissions. And the reason it's levelling off its global carbon emissions is because of the air pollution issue. It's because the health issue got so bad and there was such social discontent about it that was the driver of climate action. And so this is one of the reasons we think that health can be such a strong argument for getting on top of the climate crisis. And another way to illustrate this is to illustrate the overlap between the solutions. So I would challenge you to look at any of these solutions that we have on this slide and to say whether that's a climate solution or a health solution or an air quality solution. The reality is that every single one of those would be good for the climate and good for health as well. So it's just to illustrate we have a real action agenda of things that we can do which will help to solve the climate crisis and which will also promote health. And we are also starting to see political commitments on this as well. And I would say for the first time, speaking from the health side, when we go to climate conferences, I would say that for the last 20 years, we'd be knocking on the door saying, you need to remember health when you talk about climate change, and getting a bit of a brush off. And that has changed. Basically, the climate, the people talking about climate change are now recognizing that health is one of the main reasons for why we should act on this. So in September last year, the UN Secretary General called a climate action summit to basically prepare countries to try and scale up their commitments that they would bring back to Glasgow, which is 5 years after the Paris Agreement. And they asked WHO to say, what can you do to get behind the political argument for stronger action on climate change? And so what we did was to ask countries to commit to providing clean air for their populations and aligning that with their climate by 2030 and aligning that with their climate policies. Because we think that as soon as they've made that commitment, as soon as they've lined these two things up, that will start to drive progress. And we were pleased, in quite a short time, we got over 50 countries to sign up. That's a population of over 1 billion people, if they're serious and if they can be held to it. And if we manage to keep those commitments, we will save 400,000 lives a year. That's a massive health gain. And we're going to continue driving forward to get more countries to sign up and to make sure they're serious about it, to hold them to account. The final item on the agenda, and the real reason I was so keen to talk to you today, is actually the role of the wider health community. Some of us have been banging on about this for far too long. And the most encouraging thing I've seen within the last few years is the beginnings of the mobilization of the broad range of health professionals, not only the committed sort of odd few that are really sort of, as I say, already converted on this issue, and that we think is one of the strongest things that we can bring to climate action. I'm a fantastic fan of Greta Thunberg. I love this photo. It captures two fantastic women with bringing inspirational messages. This is Greta turning up in the US, including to speak at the Climate Action Summit and to work with us in September. We think this is a fantastic thing, which has really moved action on this issue. But one of the other things that we can bring to this is different kinds of voices. So at this stage in the presentation, this is basically a pop quiz. It's a recognition game. See how many of these faces you recognize. These are all people who have spoken at our health and climate change events over the last year and a half. I won't ask you to put your hands up in the room, even though I can see you. I'll just tell you the answers. This is my boss. This is the Director General of WHO, Dr. Tedros, who, although he is spending most of his time now talking about coronavirus, he has been absolutely consistent since before he became Director General of WHO that the climate crisis is a health crisis as well. And so this is him speaking at a special event at the big climate change conference in 2017. This one, I'll give you just a few seconds. This is his boss, or his previous boss, the previous UN Secretary General, speaking at our Health and Climate Change Conference by video message in 2014. This is Christiana Figueres, who is the architect of the Paris Agreement, who was also speaking at our conference, but she also gave the keynote address at the World Health Assembly in 2015, making this connection. This one is for any of you who are fans of Hello or Hola magazine. This is the Queen of Spain, who is also committed on this issue, speaking at our last event in Madrid at the climate conference. This one you will probably recognize now as Meghan Markle's father-in-law, again speaking at our climate change and health conference in 2014. This one, for those of you of my generation, will need no introduction, again speaking at our climate and health event at the Climate Change COP in 2017. And he was absolutely fantastic, and basically was making the case that the lack of action on climate change is the biggest communications failure of the last century. And the reason we have failed on this issue is because we were not talking about health and pollution. So the event he spoke at was all about not the fact that climate change is damaging the natural environment, but the fact that it is killing people and will continue to kill people. And now if you prompt Arnold Schwarzenegger on climate change, he will start talking to you about health. The final one, this is Greta Thunberg visiting an exhibition that we had on the front lawn of the UN building at the Climate Action Summit in September last year. Again, she was absolutely fantastic. Immediately got the connection between health, air pollution, and climate change. It was quite a hot day. these pollution pods mimic levels of air pollution in different cities around the world. They don't actually have the harmful pollutants, but because it was a hot day and it was quite an intense experience, she suddenly started to have a funny turn, and we thought the last thing that we can do is to kill Greta. That would really not help the global climate. But luckily it wasn't serious, and she has carried on, I would say, being a fantastic advocate, not only for protecting the planet, but for protecting the health of the people on it. So this is just to make the point that we do have these diverse, in some ways, high-profile voices on climate change. But we think, in fact, the single most powerful voice on acting on climate change is the health community. And the reason for that is that the health community is an impartial voice on climate change. People will sometimes question the motivation of environmentalists or politicians on wanting to act on the climate crisis. For good reasons. The health community, I would say, is seen as relatively neutral or evidence-based on this. The reason that the health community is concerned about climate change is not because they're environmentalists or because they have a political agenda, it's because they see the connection to either worse health or better health for the people that they treat and the people that they work with every day. We have evidence on this as well. Hopefully you can read the text on this slide. But basically, this is a study from my country on most trusted versus least trusted professions in the world. Over on the right-hand side, the extreme right-hand side, if you can't read it, I'll read it out to you. Those two categories are government ministers and politicians. On the extreme left-hand side, you have doctors. Doctors are the second most trusted profession in the world, beaten only by nurses. So it matters when doctors and nurses say that they're concerned about the climate crisis and that there are things that they can do in order to address it. You will probably, many of you will be aware that this year WHO has designated as International Year of the Nurse and Midwife. And we are linking up with our nursing and midwifery colleagues who are now starting to mobilize around this issue to basically join forces and basically to reinforce why they should be in the spotlight on a wide range of issues. But one of them is action on the climate crisis. So just the last couple of slides I'd like to present then are about the importance of connecting the climate change and health stories. So we can do this in many different ways. So I've already mentioned this Breathe Life campaign where we're targeting individual cities. We have global calls to action. We and others, and I would say we're a pretty tight-knit community on this. You will get the same answer from WHO as you will get from the NGOs working on climate change and health, or the International Federation of Medical Students Associations, and so on. That there is, quite a consensus, I would say, on what the agenda is on climate change and health, and they're starting to, hopefully you are starting to speak up about it. You're also seeing it reflected back from the other side as well. So particularly in the most polluted parts of the world, this fantastic climate strike movement that is spearheaded by Greta Thunberg and all of the other brilliant young people, they are already making the connection to health. And so when you see the Indian climate strikers demonstrating, they're also holding up pictures of lungs and saying clean air is a human right because they see this connection. And just a small bit of advertising, in the middle of the big global climate conference in Glasgow in 2020, we will be bringing the health argument and the health voices. We will be having our next global climate and health conference in the middle of Glasgow, in the middle of the COP, between the 2 weeks of COP, to take the health voice directly to the climate negotiators. So that's basically the end of my presentation, and it's basically a request for you to please give your feedback. Please also on this presentation, as I say, it's a bit of a risk turning down this wonderful invitation and doing it remotely. But just also, but hopefully by way of encouragement, just to give a signal of the kinds of actions that we're seeing cropping up from around the world. So I come from the UK. We've seen just within the last, month, the National Health Service in the UK, the single biggest employer in the UK, one of the biggest employers in the world, has just said it will aim to go carbon neutral by 2030. We've seen health practitioners associations divest their funds from fossil fuels. This is one that popped into my Twitter feed within the last day or so. I then realized that the Canadians, of course, had done it years before. The Canadian Medical Association divested in Vancouver in 2016. And that the picture you see on your screen is friends of ours, two of them interns in our group, brilliant young Canadian physicians who have driven this movement, and even doctors starting now to become really quite, some of them at a certain part, and it may not be something that many people feel comfortable with, but is starting to advocate on climate change. And the absolute final slide is just again, my excuses for not being with you. This popped into my Twitter feed about half an hour before I was due to give this presentation, a paper that was just published, including by colleagues that you just saw on that last slide, of making the case of why we should try wherever we can, and even within our medical conferences, to see if we can reduce our greenhouse gas emissions. So I'll just sign off and say it's been an absolute pleasure talking to you. It's been a shame not to be there in the room with you, but I hope that we can still have an opportunity to interact. If not now, then in the future. Thank you very much.